Hi, welcome back to the Dr. Akinde Breaks It Down video series. I'm Dr. Akinde. I am doing this video today. First of all, thank you for joining me in helping me just kind of take the time to um, and make this video and to provide some measure of information for the public. Uh, it's been a long time coming. There's been this outbreak, this pandemic that's now developed, that I feel it's important to just provide some information about. The reason that I find it important is because it looks like it's something that could potentially cause quite a big stir, quite a big issue. And so I think it's important for us to have some measure of reliable information about it. The issue is that at times like this, people become, self-styled health professionals and things like that. And I think it's important for pediatricians to make sure that we kind of create a space, especially online, to provide people with information that they need, as opposed to letting them be kind of subjected to the whims of those who don't know too much, but would purport and claim to know so much. So, first of all, please understand that this is not medical advice. And so, sometimes people want to parse that and say, oh, but you're a doctor saying stuff on the internet. That doesn't mean that I'm advising you to do one thing or another. It does mean that I'm giving you information. And I think it's fair and reasonable for people to share information. This is information that you should take maybe to your own healthcare provider and have a discussion with them. What I try to do is provide digestible, broken down versions of the scientific information in order not to kind of overwhelm people with what generally involves a lot of scientific jargon and things like that. All right, so a couple of things. One, today's t-shirt is this one. It says, Earth is not flat. Vaccines work. We've been to the moon. Climate change is real. Stand up for science. Really, those should be morning mantras that people chant and repeat every day before getting their day started. But I'll leave that up to you. Again, information, not necessarily advice. All right. So now let's get on with it. So it seems that we've got what we now can consider a pandemic of the nCoVid-19, or the coronavirus, as people are saying. The thing about coronaviruses is that they've been around for a really long time. So the coronavirus is one of many different types of viruses, of course, but this is one of the types that causes respiratory illnesses. So it can be anything from as mild as cold symptoms. It can be as severe as flu symptoms. And in some people, it can actually be even more severe than flu symptoms, in that some people recover from flu. The flu itself can be dangerous. That's why vaccines are important. All right. But in the case of coronavirus, it can have very serious effects on people's health. The people most seriously affected by this strain of the coronavirus is the very old people. It appears that young people tend to be more likely a transmission vector, meaning they don't get too sick from it, but they pass it on to people. And of course, the people most susceptible in our societies generally are the very young and the very old from infectious diseases and maybe a whole lot of other things, right? So really important that we still make sure that, as you've all heard, keep our hands clean and not touch our faces. It's amazing how often we touch our faces during the day. One of my favorite new things to say to people now is that whenever I go to the movies with my daughter, for example, we come out. I ask her, meet me right here, and then when we're on our way home, we can just head on out. I watch grown men in their 40s and 50s and 60s walk from the urinal or the stall and out the door without stopping at the sink to wash their hands. Now, where do those people go? Right? Do they go to one special place? Do they go to their own one town house or enclave or enclosure? Excuse me. No, they go everywhere. Those people live amongst us. Those people are us, and you know who you are, whoever you are. Right? And those people are spreading germs, right? And that's how germs get spread when people don't do the simple act of just a little cleaning up. These guys, man, just wash your hands, use hand sanitizer, and try not to touch your face. So it's really important. I don't think we necessarily need to get into all the scientific information about the coronavirus and why it's named the coronavirus and whether or not it's got an envelope or an RNA genome or a DNA genome or whether or not there's reverse transcriptase and all the rest of this. I don't think that matters here. The thing that's important is making sure that you keep yourself and your family well protected. So some of the things that are, of course, are important is what I said, keeping your hands clean. Second is avoiding large crowds. And as you've known, there have been lots of sporting events, which generally tend to kind of get a lot of people gathered in one place, that have been canceled around the world. Some kind of started with, okay, so we'll have the event, but without spectators, right? Because you can have tens of thousands or hundreds of thousands of people in one place. And they could easily transmit the germs to each other. However, now they're just outright canceling certain events. And I think that it's going to multiply. So different sporting entities and higher education institutions are taking that step. So gathering in large crowds, some people would define that as 250 or more people. Some people might say it's just 100 or more people. It really doesn't matter. The idea is try not to be in the middle of large groups of people for a while. Another thing that's important, of course, is making sure that as you keep your hands clean, you avoid people that you can easily tell might not be well, that might be sick. They're coughing, they're sneezing, got a runny nose and things like that. I mean, even if it's a friend or a family, just let them know, thank you, I gotta go. That kind of stuff. And the reason simply is the longer you're exposed, the closer you are in proximity to them, then, that increases your chances of getting sick. So try to avoid, being too close and spending too much time with people who are feeling symptoms of illness. Another thing, of course, is to avoid travel to endemic or places where things are showing high levels of virus activity. That's kind of hard, but some of them are more obvious. There's some countries, maybe some more reasonably than others, that are involved in travel bans and things like that. I'm not sure that we necessarily should be stopping all travel, but I think the important thing is to try to make sure that we travel safely and in as healthful a manner as possible, which involves, of course, bringing hand sanitizer with you when you travel, cleaning every surface that you can that you know you're going to touch or come in contact with. That's really important, especially if you're traveling with babies and things like that. So the really important thing in this, of course, is reduction of transmission. That's the key, right? So that really is just about all of it in a nutshell. Please remember that it's a viral infection, and actually, there's one more thing. So the president of the United States recently mentioned that once April comes around, the virus is just kind of going to disappear. I think there is some measure of truth to that, but I also think that there might be an accidental kind of happening on what may actually happen, which is that during winter season, we gather indoors and we cough and sneeze all over each other. We touch surfaces and then we touch our faces. And that's how most of these viral infections get transmitted, either by droplets or by direct contact with our face. What we can do is, once warm weather arrives for us in these northern climes, is we open the window for fresh air or go outdoors, and then we're actually just literally just spacing ourselves apart so that we're not in such close contact with other people. That can reduce the transmission of the virus. It's not necessarily that, oh, the temperature's 75 degrees today, whatever that is in Celsius. I'm sorry, I can't convert it right now. That the temperature, it's not necessarily the ambient temperature, even though you can imagine that when it's much, much warmer, let's say 100 degrees Fahrenheit, it's probably, hotter and therefore less humidity happening, if it's not a humid climate, where maybe the droplets that the virus sits in evaporates faster, and therefore there's no place for it to sit for a longer period of time. But generally, that is not kind of very well proven. The idea is, once the weather allows, get out, get outside, enjoy the fresh air as much as you can. And if you can't, that's fine. Open windows, still continue cleaning as much as you can. Soap and water works magically. You don't need to buy up all the hand sanitizer that's available at the store. I'm not even sure why people are buying the toilet paper. Right? What's that doing for you when it's a respiratory virus? I guess people need something to blow their nose into. Okay. But, you can blow your nose into a regular tissue. But make sure you wash things. Soap and water, please. All right. That's the information that I wanted to provide. That is essentially a corroboration and a support for the good information that you've had. There's no need. There's also actually another thing, which is making sure that you self-isolate if you are feeling sick. And the reason being that if that's, which is less likely right now in the northern climes, especially in the United States, than the flu, you could likely have the flu. But if you have coronavirus, you should, before getting tested, try to avoid getting into large crowds of people. Therefore, you're not contracting the disease, passing it on to others, and then finding out that you've had it. Instead, you start with the conservative approach. Try to figure out whether or not this feels and seems like coronavirus, which usually takes something like 2 weeks to get over. And then you go back or you call your healthcare provider's office to figure out whether or not you should be seen, be tested, and how to go about that. It's in flux. It's changing depending on the local jurisdictions. Generally, the CDC and the state health officials are the ones that do the testing here in the state of Illinois. But it depends on your state. You just got to talk to your local healthcare provider to find out what next to do. So it really is that it's a situation where we should all avoid panicking, but to take it seriously. And by taking it seriously, the thing to do is keep these guys clean. I guess I should do this. You see this? Look at that. You got to vote. You make sure you get out there and do your civic duty. It's really important for situations like this. You put people into office who take science seriously, because while we all have our upbringing, it's science that connects us all. Gravity affects every single one of us. We all require 21% oxygen in order to breathe. Our hemoglobin's all red. Science. All right. So thank you. Thanks for stopping by. Thanks for giving me a chance to just kind of comment with my own kind of thoughts on these things. Come back frequently. Like, share, subscribe, comment, ask questions. Keep yourselves well.